experience for the participants. I would also like to thank our sponsors whose support has made this event a much larger success. Salesforce, Microsoft, CAMH, Markham Superstore Hospital Corporation, Thinking North, Ivida, Roche, Sightline Innovation, Octachain, Capital Blockchain, Tech Zenzi, MD Canada, Canelo, Canbut, Cannabis, Seneca Alumni, and Seneca Helix. This hackathon aims to connect, inspire young minds while supporting the digital health professionals creating the future of health in Canada. Hackathons are the best way to learn and tackle real life challenges. Some of the advantages of this event is trying to make a difference, networking with our sponsors, making new friends, and having fun while doing so. This event is a fantastic opportunity for current students and professionals to explore innovative ideas and present them to real life investors to commercialize your ideas. Students might also secure a paid internship with our sponsors, win cash prize, add a micro credential to your resume, and so on. We have close to 600 participants today, and we encourage you to use our chats to share ideas, seek support from our mentors, collaborate, improve your ideas, and help each other. Our mentors are industry leaders with decades of rich experience. So, what are we working on for these 4 days? Our challenge sets. We have 8 challenge sets. Each one presents an opportunity to come up with a unique solution. We have a group of volunteers focused on your success. We call them Student Success Officers. Make sure you know who your liaison to the challenge set is. They can help you. The challenge sets are monitoring system to support remote elder care, digital health or vaccination passport, cannabis product life cycle, patient data consent system, addressing problem gambling, video game or social media addiction, telemedicine, rare disease data science and research, hospital HR systems, etc. We are posting the names of all the liaison in the chat box now. Still not sure which challenge set you want to participate in? Let our registration team help you decide that. You can contact Vikramjeet or Bridge for more details. We will be adding their information to our chat box too. And with that, I encourage you to use this week to engage and have fun with your fellow students and teams. Apart from the actual event, we also have an amazing lineup of thought leader keynote sessions. I encourage you to listen to those and engage with the speakers. Also, do not forget to follow us on social media. Post a picture while working, tag us at Seneca Digital Health Hackathon. While these pictures will be used in creating an event video, we will also use these pictures to have external media come to the event. Wear your hackathon t-shirts and post a picture now. We will be posting our social media handle details and the hashtags in the chat box now. I hand it over to Mark for his remarks.
Okay, thank you, Maithili. Just a couple of things here. Promoted some of the folks to panelists so they can post information to the team. Also, the way we set up the WebEx events, you as the attendees cannot see who the other attendees are. So I saw a comment there that said, "Hey, I'm the only one." No, we have about 160 online here right now. So if it looks awkward, no, you're not the only one. It's just the way that I set it up for today. So Yeah. But in any case, what I'd like to do, Maithili, is I'll pass it back to you and you can introduce Chad, who's here.
Yes, thank you. So we have a first keynote session by Chad Lever. Chad is the director of Seneca College Applied Research. He's one of our biggest supporters for this hackathon and the learning experience. He has a vast experience in healthcare. Let us see what he has in store for us. Over to you, Chad.
Hi, good morning, and thank you for that great introduction and this incredible opportunity to kick off the hackathon event that with 600 participants is sure to be an exciting and momentous event for Seneca and everyone involved. I've just got a short presentation I want to share with everyone today. So my name's Chad Lever, and I'm the Director of Applied Research at Seneca Innovation. I come with about 18 years of experience evaluating health system transformation and 9 years focused specifically on Canada's investment in digital health technologies, from clinician investments in clinician systems and provincial systems, as well as patient portals and virtual models of care. I'll talk a little bit this morning about Seneca Innovation and our approach to applied research, and give you a brief digital health primer to kick off this amazing, fantastic event this week. So Seneca Innovation is part of Seneca College. We foster a culture of innovation with students, faculty, and staff, and our broader community members. We have Seneca Helix as part of our department, but in Seneca Applied Research, we focus on student researchers, advancing technology for our industry partners, and really are solving industry partner challenges. The approach to our work aims to provide practical solutions to businesses to solve their technical challenges. We don't do fundamental research or basic research or pedagogical focused on teaching. It's really the application of systematic inquiry through an iterative process towards problem solving, where we meet the business's challenges and advance prototypes and results that are commercially relevant for businesses to advance their impact on their sectors. Last year, Seneca had research across a number of fields, including software data science at 33%, a lot in biotechnology and cosmetics at 28% of our projects, and social innovation design and healthcare at 25% of our projects. So 2/3 of our projects are in software, AI, ML, and social innovation design and healthcare. We had 57 applied research projects last year, supported by 46 faculty investigators, and 190 Seneca students worked on our projects, 13 of whom received job offers following the engagement. And we received over 2.8 million in research funding last year. Our funding sources include NSERC, the National Natural Sciences and Engineering Research Council of Canada, CIHR, Social Sciences and Humanity Research Council of Canada, Ontario Centres of Excellence, which is now Ontario Centres of Innovation, MyTax, and we have a Seneca Research Fund, Seneca Innovation Applied Research Fund. Our approach to projects include cash contributions from the partner between 10 and 50%. If we're working with a nonprofit organization, it's typically 0%, but all projects require in-kind contributions that are a measurable collaboration contribution to any project. Our project timeline tends to start aligned with academic terms, with projects starting in September, January, or May, with a typical 3 to 4 month time when we work with partners to actually establish the project, prepare the grant, and develop the project plan and initiation. All of our projects are supported by Seneca faculty with the technical expertise to meet the industry challenge, usually full-time faculty who are relieved of some academic duties. We do engage part-time faculty regularly who get additional research contract hours, and they select, supervise, and mentor student research assistants who apply to work on the project. The real added value for faculty is they apply their expertise from their sectors to research to forge new discoveries and design new applications. They advance Canada's knowledge sector, and they transfer knowledge back to the classroom. For research assistants, they're working under the guidance of the principal and investigator, and they're engaging closely with the partner throughout the project. They're employed by Seneca, and they tend to be experienced and upper year students who are applying their skills and knowledge. They are getting a real experiential learning opportunity and have options for future employment. Intellectual property for all of our applied research projects resides at Seneca, and we transfer that back to the partner. So it's a real win for all business partners to retain the intellectual property to advance their businesses. Of course, to learn more, please visit the Seneca Applied Research website to learn how to work with us and see our project showcase of our current and past projects across focus areas. So a little digital health primer, the data, the users, and you. And this comes from much of this data from the work that I have done in the past, and also the most recent 2020 Commonwealth Fund survey of 11 countries, which was just released in February of 2021. So this data is extremely relevant and I think helpful for the hackathon. And I've put sources in the slides, so I think you can capture some of this information more in depth through various data tables that this Canadian CIHI and the Commonwealth Fund have available currently online. So Canada has taken a very interesting approach, not unlike many other countries with respect to establishing its electronic information systems for clinical care. Every province has the base provincial information system, which consists of a number of repositories for clinical information. And as you can see here, it ranges across the country, as high as 94 and 93% in Newfoundland and New Brunswick, where primary care clinicians say they have access to this regional information to support patient care and see patient information from outside their practice. It's as high as 95% in Alberta and even up to 80% in the territories. Among Canadian primary care physicians who use EMRs, when I first started in covering this space in 2011, there was just 24% of Canadian primary care physicians using a computer in their offices to support patient care. As of this survey in 2020, there are now 86% of Canadian physicians using an EMR in their practice. They tend to be physicians who work in group practices, and most physicians are using it for advanced features, such as looking up patient information, but also doing proactive patient care. In comparison to other countries, though, Canada still lags slightly behind the Commonwealth Fund average, lower than the United States, lower than the United Kingdom, and other European countries. Across Canada, many Canadians have access to a personal health record, and there are patient portals initiatives nationwide. As many of you may know, if you've had a COVID test, you can get those results online, and many provinces have lab repositories where patients have access to their health information online. In most cases, though, Canadians are simply accessing a single point of care source of information, such as their doctor's EMR or a hospital information system like Sunnybrook MyCare. They're accessing specialty clinics. They're not accessing a universal in one location all of their health information. And that will really be resolved through an identity management approach. This model is really siloing data and hindering continuity of care and a number of value opportunities when it comes to digital health in the Canadian context. And most Canadians can't really enter informational aspects into their own record at the present time. And over the last 2 years, how have Canadians actually been looking at their information? In the past 2 years, it's gone up slightly. Canada is now at 50% of Canadians saying that they've accessed or downloaded their health information, such as visit summaries or laboratory test results. And what's interesting here is that it doesn't matter what age group Canadians are in. Whether you're above 65, above 75, or if you're a youth and you're 18, you're just as likely to be accessing your results online, which really demonstrates when this service is available, Canadians do access it as a supporting aspect of their care. As this looks internationally, though, Canada still lags behind a number of countries with respect to citizens' access to their own health information. When we talk about patients who can email or communicate with their doctor about a medical question, Canada ranks at 7% of Canadians who say that they can do this with their doctor. It's important to note that in 2019, in a separate physician survey by the Commonwealth Fund, that 23% or 1/4 of Canadian primary care doctors say that they offer this option to communicate with them via email. And often this is very patient specific, where physicians or the practice provide patients the opportunity to do that. And as you can see from this graph, Canada lags quite significantly behind the Commonwealth Fund average at 15%, and other European or the United States, where many of those countries allow citizens to communicate with their physician via email. Going a little bit deeper into the data, just a few more slides. Canadians in rural areas compared to urban or remote areas are less likely than urban residents to access online services. And this is true for those who are even in lower income brackets and live in rural regions, slightly less likely to view their test results online, book an appointment online, or email their doctor. So this tends to be more of an urban phenomenon. Now, I want to talk just briefly about the value of digital health from a patient perspective, because this is really what's behind the hackathon event and the outcomes that and of the challenge sets that everyone is tackling over this week. There are patient online solutions and challenges that you are addressing during this period, and there are aspects to those solutions that are about system quality and the information in those systems and how they're used, both by clinicians or patients, and how happy or how satisfied users are about their ease of use and the experience with those systems. And the use of those systems, it has benefits, has impact across disease prevention and management, patient-provider interaction, the overall quality of healthcare services, like the appropriateness or the effectiveness of the services provided, and the efficiency of care services, as well as impacts on health service utilization. There's been a national study on virtual care in BC, which showed that patients who did have access to a virtual visit actually went to the doctor less, implicating that they got the care they received when they need it. And this was compared to patients who saw a physician in person, and it was matched with respect to the risk category or the severity of illness that individuals were experiencing, excuse me. So overall, use of systems can improve health status, improve patient safety, improve patient-provider satisfaction, access to providers and services, and overall improved health system productivity. And all this really summates into what is the engaged patient. There's been good research on how individuals who are engaged with their health information and use that in the context, so to speak, of engaging with their providers, they become highly confident in their ability to work in partnership with their care providers, and they rate themselves as being very involved in managing their own care. And patients who do have access to their health information, and this is grounded in a number of Canadian pieces of research, knowledge of their own health has increased, they're more confident in managing their health, they feel more involved in their care, and it allows them to have more informed discussions with their doctors. And the outcomes of that are really that patients and caregivers avoid costs associated with unnecessary in-person visits because they're on top of their care. But more substantially, there are really good economic indicators about patients having increased life satisfaction, which equates to increased household income for Canadians in the base literature. They have improved health status. There's good research in diabetes showing great glycemic control and other clinical areas as well. And there's an overall increase in positive health behaviors in terms of medication adherence, where patients are involved and have access to their own information and have access to timely e-services. And finally, the healthcare system itself can avoid, and this is based in the literature, of avoided ED visits, reduced inpatient admissions, clinician and clinic consultation and admin time, and avoided medication errors, really all equating to billions of dollars saved of value in the healthcare system and the health of individuals. I want to wish everyone an amazing week at the hackathon. Please consult these resources if they're aligned to supporting you in your challenge sets, and all the best in reaching your goals this week.
Thank you so much, Chad, for that insightful presentation. I'm sure it's going to help all our participants during this week. We now welcome Brian Day, Healthcare Executive, Salesforce Canada. Brian leads the public healthcare team at Salesforce, bringing on 30 years of technology and health and life science experience, looking to actively partner with organizations that are transforming healthcare delivery through new technology and innovative business model. We welcome you, Brian.
Thanks for having me. Can everyone hear me okay? Coming through loud and clear?
Yes.
In this typical pandemic work from home fashion, I'm running around the house trying to hide from 3 teenagers in a construction project. So apologies if my video was going on and off, but nice to meet everyone. First of all, I just want to thank Mark and the entire Seneca team. It's a privilege to be here. These kind of efforts are super important for our industry. There's a lot of there's a lot of thought leadership. I mean, Chad, brushed on a lot of sort of key themes that we're trying to solve for in this market. But I think certainly amongst the crowd that's participating in the hackathon this week, you're going to have a little bit different perspective than I think, than maybe other people might, right? As a, millennial or whatever the label is for the 18 to 30 crowd now, you're going to have a little bit different perspective, I think, on sort of healthcare delivery, healthcare services, expectations, outcomes. And as you sort of think through this, you can think about, care that you might be, helping with for your mom or your dad or your aunt or your uncle or others in your family, and just think about sort of ways technology might sort of help their care, whether it's proactive or reactive or things that you can do to help engage. But I think that's an important thing as you think about this hackathon, is think about those that are close to you and things that they might be going through and how technology might help them. But it's been a bit of a crazy year. I know at our company, we've been sort of busy, solving for, I'll just share my screen here, solving for a bunch of the sort of challenges around the pandemic. And certainly I think it's taught us a lot, right? We've had to really start to sort of rethink about, it's not just maybe a technical problem, right? When we're thinking about how to solve it. If you take vaccine management, seems to be the sort of latest wave in the pandemic that we're actively trying to solve for, and including here in Ontario. But there's a bunch of considerations that you have to take in. That is, technology is certainly one piece of it, but there's an inventory aspect, right? I'm sure everyone's hearing in the news now, where's the inventory, who's got it, which province has it, is there enough in Toronto? Is Toronto getting more than their portion versus Peel? There's a certain equity element to this as well that I think we have to think about, or an ethical element, which isn't something we often as technologists sort of think about, right? But, if we're, where should the vaccine be going, right? I mean, obviously we know the most at risk should get it, but what portion should be going to First Nations communities? What portion should be going to homeless communities who may not even have, an Ontario health card? We have to start thinking about, how to solve for sort of, segments of the population or cohorts that wouldn't normally be kind of first in line for a vaccination. That might be really important. You have to think about scheduling, where can people get access to vaccines? If you think about I know in Ontario, they're starting with the over 80 segment this week to get sort of the broader population vaccinated. But a lot of people in over 80 are either living at home, don't know how to schedule themselves, right? Don't have access to scheduling, don't have a ride, to get to a center where they can actually get the vaccination, right? And so these are sort of complicated problems from a technology standpoint to think about how to engage with, right? So is that, do we sort of engage households in that to help with, making sure mom and dad or grandma or grandpa are getting scheduled to do that? If people are applying or registering to get vaccinated, we have to check and make sure they haven't already got vaccinated, right? Or that they're eligible. I can imagine in a couple of weeks when Ontario opens the vaccination portal, there's going to be a mass rush to get there. Even if they're asking people only over 80 or only over 75, you're going to see other people show up, right? And you have to make sure that you're ensuring that people that are eligible to get the vaccine are the ones that are getting it, right? Because they're the ones we're most trying to help in all of this, right? But there's a lot of these sort of logistics that we as a company at Salesforce have been working on throughout this sort of pandemic. But it's sort of been almost a wave of of learning through this entire pandemic. I mean, if you think about this is sort of focused on the vaccine piece, but early on about a year ago, it was all about how do I get an assessment to figure out if I need to get tested or not. Then it was, well, how do I get tested and where do I go, right? What was how are we going to do that? And then it went into things like case and contact tracing, right? And then now we're into vaccination management, and then we'll continue to sort of we've all, as the world, we've had to learn in health, like on the fly, how to do this. we've had, winter influenza vaccinations for many, many years now, but the scale of this problem and the speed with which the virus moves from person to person is so fast here. We can't, wait for years to deploy technology. We're talking about days or weeks that we have to do things. And this is why cloud computing, I think, has been sort of front and center in helping to solve some of these problems. But, we're in a constant sort of state of just trying to learn sort of what is next, right? And I think, I think Mark and the team have done a good job of sort of, putting this sort of credentialing or immunization passport or immunity passport or, front and center in this hackathon, right? To acknowledge that this is the wave we're on now, right? This is the immediate problem that's coming in front of us now that we're starting to get vaccines out. In the next 2 or 3 months, we'll start to have most of the at-risk people vaccinated, and we'll start to move into sort of broader communities, and you'll be able to, go to pharmacies and your primary care physician to get vaccinated. But we're already starting, and we're running the program in Ontario for vaccines now. We're already providing either email, text, or printed receipts to prove you're vaccinated. And where that comes really important is that's going to start to delve into a little bit of our everyday lives now. Because you can imagine going forward, and I'll throw out some examples, if you want to get on an airplane in the fall and go somewhere to another country, before you get on an Air Canada flight, they may very well ask you for proof of immunization. If you want to go to a Maple Leaf game in the fall down at the Air Canada Centre, they may very well, before you enter that facility, want proof of vaccination before you come in. You can think about border crossing. Maybe we might even do that interprovincially. There may be if you're going to go do some work in Quebec and fly to Quebec, they may want to verify that you've got you're up to date with your immunity. And who knows, we may get boosters down the road. This might not be a sort of a simple one and done vaccination. We might have boosters. And so there's a constant, updates to these records that need to go on. So I think for those who have signed up for this particular challenge in the hackathon, this is a really interesting one to think about, right? Because it's, A, there's the receipt piece, but B, it's also who are all the people that need to verify that you've actually got your immunity is up to date. You may, like at Salesforce, we may have in downtown Toronto, our office, if you want to go there, they may ask you for to verify immunity before you come to a meeting at the office. And if you're going to a manufacturing facility or a job, who knows where this sort of verification of this proof of immunity is going to show up. So these are all sort of, food for thought for today to think about, what we're trying to solve for here. How do we make this easy? How do we provide the credentials once you've got your vaccine in the arm, instead of making maybe a printed receipt or sending an email with a QR code? How do we send a digital credential that goes into a digital wallet, right, where people can, and then how does a verifier verify that you're who you say you are and that you're up to date in your immunity? So it's a really interesting challenge, and one I know every health jurisdiction in the world is thinking about right now. This isn't just an Ontario thing. This is every province in Canada, every state, every federal government, Australia, New Zealand, UK, Ireland, Germany, you name it. Everybody is thinking about this now. So it's kind of super topical and very, very timely, obviously. So I thought the other aspect of this, and this is more sort of our regular jobs that amongst the Salesforce public health team, and this will pick up on a lot of themes that Chad just went through in his presentation. Very much our healthcare system in Canada, and I'll talk more specifically sort of Ontario, Canada. But it is much of a reactive system. There are certain sort of proactive things that will go on with organizations like Cancer Care Ontario and others. But for the most part, if you feel good, you don't go to the doctor, right? Unless your mom or dad or spouse tells you got to go for your annual checkup. I mean, most people don't go. It's only when you start to feel bad do you actually sort of show up, which just seems like the wrong way to sort of attack the problem, because there's so many things that we could be doing easily and proactively with technology that should make this really, really easy, right? There's, if we just think about, the sort of leading indicators of all of the, cancers and heart disease and all the sort of big killers in our market, there's a lot of leading indicators that are pretty easy for us to pick up on. Obviously, there's diet, fitness, just education, understanding your genealogy. It's a lot of these things are inherited traits. And so if we know that these are things we should be monitoring, there's lots of ways we can be very, very proactive about sort of how we, how we take care of ourselves and how we take care of our loved ones, right? More importantly. So I think in our day-to-day lives, and and some of the other challenges beyond the immunity passport, right? I mean, you're going to pick up on some of these things. These are, I think obviously with the pandemic, I think everybody who didn't know what virtual care was all about is now all of a sudden figured out that it's probably a pretty good thing. Some of these stats are sort of pre-pandemic stats, but obviously follow-ups for people, especially when you get into seniors at home. There's a lot of things we can be doing in home with seniors that are super important. We have a project out on the East Coast now to do senior in-home care, and in the East Coast there's a lot of the demographic is highly skewed to sort of over 65 populations who are living alone. And what they're trying to do is, and it's very expensive, obviously, when a senior comes into an emergent, into the ED or emergency room or into a long-term care facility. They're really trying to think about how to get proactive with the senior populations, right? So that they can, whether it's a monthly visit or a weekly visit, maybe by a paramedic or ambulatory care person, or somebody else in the community who can go out and visit somebody in home. And there's a lot of leading indicators that you can do while you're in the house to figure out if they're in a healthy environment or not. For instance, one of the things you can just do is go to their fridge and smell their milk. And if the milk is bad, that probably gives you some indication that there might be early signs of dementia. There might be, other health issues. If the food isn't fresh in the fridge, maybe they have trouble shopping. Maybe we should be sending Meals on Wheels to their house every week, right? Instead of to give them fresh food. And that's going to help their health outcomes a lot, right? And these aren't traditional sort of healthcare things. Like this isn't, something a clinician is going to do necessarily, but these are just things we can proactively check. I mean, checking for mold in a house is a big thing among seniors, right? If they're living in a moldy environment, they probably don't know it. And it's probably going to have very serious consequences on any emphysema or other breathing issues that they may have. But these are all areas that sort of are top of mind for me, sort of, pre and post pandemic. Obviously, Chad talked about the interoperability. This is a big for those in the challenge thinking about data science and integration and aggregation of data and analytics and AI. The interoperability amongst all the EHRs out there is a monstrous problem, right? I mean, the adoption of EHRs is good, but if you think about a particular patient with multiple chronic conditions, they could be at multiple hospitals. Chad mentioned Sunnybrook, but you could be doing cancer care at Sunnybrook, and you could be doing renal care down at UHN, right, in Toronto, right? And then you can have a bunch of specialists and a primary care physician, and then a physiotherapist and a dietitian, and other specialists. And all of these people are, yes, they're living in an electronic environment, and in some cases they provide patient access to that data, but there is no aggregation of that data into a holistic care plan. And I think that's the holy grail for the province is to, and one of the things I know that in Ontario, they're looking at these Ontario health teams now to think about these sort of care models for each of these chronic conditions so that they can get the 5 entities, including your primary care physician specialists, hospitals, health authorities, community health together to rally around your particular chronic condition. And it's going to be it's a model that provides certainly a bunch of cost efficiency, but also a model I think that is going to provide better outcomes, because it very much is on our innovative. If any of you here have had a loved one, like a parent or a grandparent who's been in the healthcare system, if you're not there to project manage across all of the different people that they need to visit and all the different specialists, right? It's very difficult for them to navigate that system themselves. This is, we need to rally the system itself, right, around, providing, this care journey through the entire life cycle of your chronic condition, your acute conditions, whatever they may be, right? And allow your house to, allow everyone who's, your loved ones to participate in that as well. So that, a son or a daughter can proactively help manage their parents' care, or their grandparents, or your spouse, or your sons or daughters, or whoever it happens to be. But all big issues, and these are things I think, as for the, most of the folks participating in this, these are really important problems to be figured out. And I think you as millennials, and I'll classify you broadly as millennials, probably have a much better point of view on kind of how to execute on some of these things than maybe the maybe the people who are running the healthcare system now. And this is why I think this hackathon is so important, to sort of bring those new ideas to the surface. Whether you actually solve end to end for a problem in the next handful of days or not is not the problem, but getting the themes out there, getting the ideas in market, getting these ideas in front of the leadership is critically important. So I commend you all for taking time out of your lives to participate in this. So, but I just wanted to thank everyone again for their time. I will say this on on a Salesforce from a Salesforce point of view, we are growing super rapidly. We have getting close to 2,000 people in Canada from a company perspective, but our ecosystem is growing every day, every week, and we're constantly looking to add great talent to that market. So there are thousands and thousands of jobs being created every month in the Salesforce ecosystem. So this could be at partners, at customers, for administrators, for developers, for technical architects, on and on, project managers, etc. And so I would encourage anyone that's interested in this, or whether you want to solve healthcare problems or others, if you just visit trailhead.salesforce.com, you can sign up for a free instance of Salesforce. Our entire training catalog, like our entire training curriculum, is included in that. And it's all free. The certifications are a couple $100 each, but you can go on, get your badges, which are all entirely free, get certified, and if this is of interest, there's certainly lots of opportunity in this market. So with that, maybe Mark, I'll turn it back over to you folks. But again, just wanted to thank everyone for their participation.
Well, we'll give it to Maithili because she's the host.
Thank you so much, Mark and Dan. I'm sure this presentation was like food for thought for all the participants, and think about the challenges and how they want to take the digital health forward. Thank you so much, Brian. We now have Wally Trenholm, CEO Sightline Innovation. Wally is the CEO of Sightline Innovation, creator of the world's only cloud narrative distributed AI and data governance platform known as the Data Trust. He is a software architect with over 25 years of professional experience and over 35 years of programming experience. Over to you, Wally.
Thanks, Maithili. If you could just give me a thumbs up to make sure you can see the screen okay, that says Sightline Innovation, and hopefully nothing else, and as well. Thanks very much. Hi, everyone. Good morning. My name's Wally. As mentioned, I'm the CEO of a company called Sightline Innovation. It's a real honor to participate at this event. Just want to comment really quickly on something that Brian said, which just really rang true to me and got me thinking about my personal experience with my family. The statement, I've never heard anyone say that the system is not set up to operate without a stakeholder to project manage someone through the healthcare system here in Ontario and in Canada. I've never actually heard anyone say that explicitly, but I can't agree more. And, we have a great system. We should be proud of it, and I think we generally are, but there's always room for improvement. It's been a slow grind to see improvement in this industry, but I think COVID really is an opportunity to innovate. So this is a really appropriate topic to dig into, and it's an honor to be able to speak with you guys today. I actually went to Seneca for a little bit after I finished my computer science degree at the University of Western Ontario. I was in the aviation program for about a year. Didn't make the cut to the next level of it, but still was really impressed with the level of education. I would say the value and the quality was much higher than it was at Western, and you know, that's yeah, the people that I met there were all very happy with their education. So anyways, just thought I'd throw that in there, and let's press on with the conversation. So digital healthcare in a COVID world. There's four kind of topics I want to touch on here. One about data, privacy, trust, and sort of various tools. And the themes, you know, kind of blend in together, but ultimately, you know, data has value. And this is a big sort of transformative thought process that the country and the global economy is going through. Healthcare data itself, like let's say 5 years ago or 6 years ago, the belief in the industry was that AI had all the value. And there was very few people with AI expertise. We were one of the first companies actually in Canada doing commercial AI research. And you know, a lot of that technology now is available in the open source realm. You know, TensorFlow open sourcing, I think around 2018. And that's around the time where we kind of came in to really see that, okay, if AI is going to commoditize, you know, where is the real value? And the value is in the data. There's various compliance laws that have come into place since that time in 2018. GDPR is one that came live, I think, in May 2018. Funny enough, it was in 10 years of development over in Europe. So someone had a lot of foresight and understanding that the data artifacts produced through a system like the healthcare system have value, and many countries now, including the United States and individual states, have taken action to sort of control the value of data and make sure that it's recognized as an actual asset for the people who own a specific system. And so with the healthcare system here in Canada costing us, you know, many thousands of dollars for each individual citizen, the data that's produced, the data artifacts that are produced by that system have enormous value. And that's why there's a lot of companies that invest a lot of time in this market to interact with that data and build ecosystems around our data. But it's important to recognize that the data itself has value. And so that's what my company does. Just to talk about that a little bit, is we built a distributed AI and data governance platform. Maybe we'll touch on what that is in a little bit. But the idea is to control the value and unlock it and preserve privacy and remain compliant. One thing I'll point out on this particular screen is this doesn't seem all that revolutionary now, but when we did the app a couple of years ago, it was. The pictures on there are not real. So this is a generalized adversarial network, or generative adversarial network. Basically, two neural networks connected back to back that learn to do things like facial recognition. But when you connect them together, you can basically have them sort of battle each other to build knowledge that can redraw faces that represent statistical congruency sort of to the underlying data set. So these particular faces don't actually exist, but they were imagined effectively by a neural network. And the reason why that's important is because while these faces are based on real information that was produced and learned by a neural network, there is no privacy information at risk in these pictures themselves because they are effectively synthetic records. And data trust, we utilize these and this particular process of generative artificial intelligence to produce high quality resolution pictures of healthcare states so that that value can be accessed without violating privacy. An example of another application sort of playing with these themes. This is a company that we do work for on their artificial intelligence backend. This particular system goes out to the internet and basically looks at sources of medical information so that it can securely integrate with healthcare systems to see what particular cases and new discoveries are relevant to a given radiologist's workload. So radiologists, without any, in a normal situation, if you break a leg and you get put in an ambulance and you go on to get an x-ray, the scheduling of you against whoever's going to read that x-ray is really just based on kind of who's on shift and you know what ambulance you got into and what's the closest hospital. This is a really simple example of how artificial intelligence and innovation can modernize the system by knowing who's on staff to read a particular radiology read. You can optimize, perhaps send the ambulance to a different location where someone who specializes in the specific condition that you need help with, where they are going to be just finished their break and in a very good focused state to do a high quality job. So these are really simple optimizations that you can take from regular industry and start to apply them in the healthcare space to get significant improvement in outcomes. In the COVID world, I mean, we're here talking about digital passports. Very, very important. We're doing some work with state level governments in this space around vaccine supply and demand management, eligibility estimation, and also disinformation situational awareness. And hopefully we get into things called nudging, because one of the biggest risks that's probably most underserved in the sort of aggregate response to COVID is that there's a lot of disbelief in the vaccine program itself. And to achieve herd immunity, I am not educated in biology in any way. I've never taken a course, not even in high school, so don't listen to me. But I've been told that you need to have 60 or more herd immunity. Well, right now, actually, let's say about 4 weeks ago, the latest data I saw said that there's a 70% trust level in healthcare professionals in the vaccine itself. So even if every single healthcare professional took the vaccine, you're still going to have a hard time getting up to that, the percentage that we need to truly eradicate COVID. And so what you could be left with, and again, I'm not a professional, is sort of a grinding on where we have to take a shot every year. And, you know, to get people to understand that the vaccines, especially the new ones, what they call mRNA vaccines, are actually the result of 20 years of very difficult scientific research and not just a result of the last 1 year in isolation. You know, we have to learn how to study the specific questions and hesitancy amongst individuals to try to help deal with the situation. Now, what's important there is that you can't study individual issues in aggregate, right? You can't understand what drives an individual's decision-making process without looking at individual data. And therein lies the rub, that you have aggregate information that doesn't have you know, any personal information at risk, and it's not capable of doing fine-tuned management of an individual situation, or you have very personal, high-fidelity information, and you have this massive privacy issue, but you can get into the exact data that you want. So managing those two things is a give and take, and we try to find a way where you can have your cake and eat it too. Just moving on to privacy, and be conscious of time here. You know, in many of you are not old enough to remember, but there was an incident in 2001, September 11th. Actually, my nephew was born that day, but about 5 hours later, there was another incident, which we refer to as 9/11. And at that time, privacy became not as important as it was 6 months prior. Difference here with COVID is that didn't happen. So privacy still matters. In fact, in some strange way, the actual conversation around privacy seems to matter more than it did before. And perhaps that's because there's heightened concerns over how privacy is going to be managed for sensitive things, specifically around health. So that's kind of what a data trust does. It basically is a mesh network that you can put over individual silos of data across different companies, connect them together using specialized technology. It's basically a combination of blockchain and what we call software-defined wide area networking. And you can build data assets such as the synthetic ecosystem assets that I mentioned before. And that's exactly what we do for state level governments, is build simulations of models effectively of individual people that are very precise but don't have that privacy risk. It's just a quick shot of what our system looks like. It's basically a way of taking Kubernetes microservices and distributing them amongst multiple clusters in different organizations. If you don't know what Kubernetes is and you are getting into this field of technology, maybe not for a web or UI developer, but if you're doing anything behind that in the stack, I would highly recommend spending a bit of time on Kubernetes. It's a technology that I actually didn't fully believe in its market dominance up until about a year ago, but many people at the company have been pushing it for several years. And let's just say that they won, I lost. It's a big deal. And when I've searched for jobs for people to hire the last 3 or 4 times over the last year, Kubernetes has always been some mention of it in their resume has basically been a requirement. And that's just me. I'm not saying that everyone's like that, but it's something that we look for. And I would dare to imagine that it's a good asset for the time you'd invest in watching some stuff on YouTube. Pressing on. Yeah, so we've talked about data. Data has value. We've talked about privacy. That's pretty important. And now we'll talk a little bit about trust. We've touched on trust, trust as it pertains to vaccine hesitancy. But the kind of trust that I want to talk here is about solving shared problems. So I'm going to give you an example. If you go to bring multiple organizations together in a collaboration and there's no centralized authority that you can all place your trust in, this is a very difficult problem of having an infrastructure that's not based in centralized trust that you can all believe in enough that you can exchange value. So we've built, this is basically what we call a data trust. We built one for the government of Canada. It's probably one of the first ones out there. Basically allows plant breeders, people who do processing of food, and farmers to exchange different parts of data, different data artifacts that have to do with the journey that food goes from when it's planted in the ground all the way to in your stomach, and producing nutrition and actual health outcomes. So creating a mechanism to connect all those people together where the farmer's not going to want to share data about their yield with the retailer, but the retailer may need to express their opinion on a specific type of product to the manufacturer, and the manufacturer has quality control issues they want to take up with the grower. All of these different stakes, all of these different stakeholders, to manage them in an equitable way that doesn't require everyone to have trust in a centralized system is a fundamentally challenging issue. And that's what, I wouldn't say that's what data trust is. I mean, that's what our data trust does, but it is the blockchain technology underneath that makes this possible. So, what is blockchain? It's a currency, I guess. There's a currency aspects of it, but really what a blockchain is a cryptographically consistent, multi-located virtual machine. So if you've touched on Java programming, the Java virtual machine, that's actually where I started my career in 1995 when that was released. That virtual machine, if you picture a much more restricted version of that with less and more expensive memory, but has the interesting property of an immutable log, and that every time I log something to the transaction record, it effectively can't be erased. That is the appropriate computational or technology framework to allow multiple people to participate in something without centralized trust. And I would say that experiment's been proven to be correct, because there's, I don't know how many hundreds or billions of dollars that are being traded in Bitcoin today, but that's effectively open source code running naked on the internet, and it still holds that value. So it is effectively a battle tested technology for decentralization of trust. And so when you connect all of these things together, there's a relationship that you can mine with health outcomes. You can have foods that are matched specifically to nutritional needs for individuals. And this, of course, relates to health. So, just want you to open your minds up to the the way that you may look at healthcare today, because when you've gone to the doctor or you've had a family member at the hospital, where healthcare needs to go tomorrow to get beyond that system that Brian so aptly described as needing project management, and get into some of those things that he also talked about, like nutrition and this sort of end-to-end health outcomes. Ultimately, that's what we want. Is we don't really want a healthcare system. We just want good healthcare outcomes, health outcomes for everyone. And that's a wide-ranging topic that requires a lot of stakeholders to get together. And so technologies that favor that are pretty important. And in a COVID world, it's even more important. So here's some tools that I talked about, just conscious of coming up on time. These are things that I'll just talk a little bit about them here. The data trust I mentioned, it's basically specialized networking, which is stuff you should look at, combined with blockchain. Decentralized finance is an interesting part of blockchain. If anyone's looking for a job and can demonstrate any competency in DeFi, I will very likely hire you on the spot. So just wanted to throw that out there. Machine learning is always really great to show on a resume. We use specific models that are not often talked about for genetic processing and things like that, which are very relevant to vaccine development as well as food. And that's where you get in this topic here of genomics and transcriptomics and proteomics, or omics for short, to include all of them. That is the study that has the field of study that's produced the bioinformatics that's helped with vaccine development. I'll point out two resources that are pretty interesting. Medcram.com. Early on in the pandemic, I was on the edge of my seat watching basically every episode. It's an emergency room physician out of California who does tutorials for physicians. So it's doctor level stuff, but he explains it fairly well. And he's the one who, people are sort of theorizing what's going on with the disease. He was always kind of out front and collating information and research from across the globe. If you have a deep interest in kind of the COVID situation and biology, I think it's a very interesting place to look at. Another thing that I'll point out is KEGG pathways. So my understanding of biology is all based on the fact that I have Asian flush syndrome. So if there's any Asian people out there, you know someone who has it. If I could give you all, well, if it was possible to have you all drink a beer, anyone whose face goes red has Asian flush syndrome, and I have it, even though I'm only half Filipino, but I lost out on that one. That's what actually inspired me to look at a lot of this stuff. KEGG pathways are a mapping of all the different materials and metabolites and enzymes inside the human body that govern everything from what happens when we drink alcohol to what happens when we eat a donut. All of this information was assembled through painstaking amount of hours I can't even imagine, from researchers all over the world. So you come to this sort of closer need to look at healthcare at a time where there's a ton of assets out there to play with. And so I would say take a look at KEGG pathways and take a look at MedCram. Those are deep topics. I mean, that's not for the faint at heart. But if you enjoy what's there, then I think, then give me a call. Maybe there's a room for you working in somewhere in our bioinformatics operation. So I'll leave you with this. Digital passports, they require decentralized trust in a way, because the information that's going to be collated and collected and processed to understand someone's vaccine state and their infectious disease state, it has to come from multiple players. It has to come from the employer, it comes from the doctor's office, vaccines, all of these things. So there's not going to be a centralized authority, at least or in Canada, that oversees all of it. It requires things to be taken from different places. So try to think about the security aspects of it, the trust aspects of it. How do you decentralize it? How do you make it tamper-proof? How do you make it verifiable? Because and actually I mentioned back here, verifiable credentials is an interesting standard from W3C, that people need the HTML standards that attempts to kind of deal with that. There's various blockchain or other cryptographic mechanisms to kind of do that. But the variability is very, very important. And that brings as a little bit dense and intense from a technology point of view, but there's some tidbits in there. They're fairly advanced topics, but I always like to say, I don't look at what I do as a job. I look at it as a lifestyle. I love what I do. I was fortunate enough to really enjoy programming at a young age. And hopefully that's the same for you. I mean, this is a very secure field to be in compared to other job fields. My one suggestion to you as people entering the field and going through education is try to keep in mind that it's a real, enjoyable thing. You're solving puzzles. It's like playing a video game. And if you can get that frame in mind, it never really seems like work. But that being said, you guys probably already believe that because you're here at a hackathon. So I will pass it over to Seneca with my thanks for the opportunity to speak with you. Good luck at the hackathon, and I'll be hanging around in the background and look forward to a very exciting event. Thank you.
Thank you so much, Wally. I'm sure that this presentation was equally insightful and motivational for all the participants. Also, thank you for bringing to everyone's notice and reiterating the fact that this hackathon can lead to securing a paid internship or a position with you as well as the other sponsors. So thank you so much. So with that, participants, I would like to welcome you all and open the session. And do not forget to engage with us and share pictures and have fun on social media. In case if you have any problem, please reach out to Bridge and Vikramjit, whose emails we have posted in the chat box. And welcome and thank you. Mark, over to you. Mark, I think you're on mute.
Oh, of course that would happen, right? The number one phrase of 2020 and 2021. Thank you so much, everyone. And it will be an exciting week. And I really just have a couple quick things to say here. For those that attended the opening session, we have recorded this, and the recording will be available to you. I know that the participants weren't able to see the other participants in chat. We had something like 220 people here live. So if you have an itch to communicate with others in your challenge set, etc., we'll do that in breakout sessions. Okay. I do want to just show you quickly something here. And this is where you should be going. So this website here, www.senecahackathon.com, that is meant to support you throughout the week. And all the keynotes that we have, any keynote from any session, if you miss the recording, it doesn't matter. Post all the links to all the keynotes and the videos here, okay? So just go to that website and you'll see that the videos, etc., will all be available to you if you miss anything. Detailed information about the challenge sets. You should be, you should have figured out what your challenge set is, but some people still change their mind last minute. That's okay. Make yourself familiar with the submission page, because that's going to be when you're done. You're going to have to submit to us the video and then any artifacts that you've produced so that the judges can see it and go through the process. There will be different levels of winners. So every challenge set is going to have a winner. I know that we have an incredibly big challenge set with lots and lots of teams in the digital passport. So we'll have 2 winners instead of just 1 for that. Over here, you can see the organizers that are involved, and just feel free to reach out to anyone at any time. And of course, the sponsors are super, super important to us. That's where you can get more information, both about the challenge set itself and what the business environment is like, and of course also technical support. And keep in mind that the sponsors will also be the ones judging the various different challenge sets. So who's going to be judging you in the challenge set will depend on who the sponsors are for that. And after we get a winner from each one of the challenge sets, then there's going to be an overall winner, and then there's a cash prize that's going to be assigned to that person as well. It looks like it'll be about $3,000. Okay, so Maithili, I'll just pass it. I'll just let you close it up. I just wanted to put those couple of words in there, And thanks to our sponsors, thanks to our wonderful team of organizers, and the greatest thanks to all the participants that want to have fun this week. So thank you. Maithili, back to you, and you can close it.
Yes, thank you so much, Mark. Again, I would like to thank all the participants and look forward to all your work this week. And all the speakers, Wally, Brian, thank you so much for taking our time and joining us and speaking to our participants. So with that, we will be closing the opening session, and thank you, everyone.